Thank you for joining me today. In this video, you will learn how to conduct a therapeutic setting. Therapeutic setting, we are going to go over therapeutic setting and what is the therapeutic setting. Therapeutic setting is a safe, recovery, and independent space. So you want to promote the safety, you want to promote recovery, you want to promote the independence of the patient or the group that you conducting with the therapy. It's where you hold the therapeutic sessions. It's a safe place where the patient can express their feeling, where they can have a healing, and where they can feel safe, where they can connect with you and the other people in the group. So, therapeutic setting is matching a patient to the appropriate level of care. Therapeutic session or therapeutic setting is the core concept of conducting the psychiatric care and delivering and emphasizes matching the patient to an appropriate level of care using the least restricted environment. You want to promote recovery, safety, and independently. Patients should receive a care in a least restricted setting that is still safe and effective. You want to encourage autonomy. There is a types of a therapeutic setting. There is an acute and highly structured setting. The acute setting used when a patient's safety is at risk and danger to themselves and to the others. Mostly that place is the inpatient setting. It's in the hospital. It is where 24 hours, 7 days a week. That is where they can get the care. So it's a locked unit. It's inside the hospital. It is they have been watched or cared for or treated 24/7. It is severe. That patient to be in that setting, they have to have severe symptoms of suicidal ideation, psychosis. You want to focus on stabilization, medication management, crisis stabilization unit. Those are short term, which is 24 hours or 72 hours held. So person can be held in 24 hours to 72 hours held. There is a 72 hours held, and that happens in the hospital. They being held because they are vulnerable adult. They are risky to themselves or to others. So that is a secure and it's acute, high structured setting. That is the one of the types of the therapeutic psychiatric treatment centers. It is rapid and de-escalation. So there is this escalation because the patient will be upset, hallucinating, and they are agitated. Some of them are violent, some of them are violent to themselves or to others, or they are running away, or they cannot take care of themselves. So they are inpatient setting or crisis stabilization units to be stabilized, to manage their medication, to control the symptoms, and some of the patients may not be able to sleep. So you want to set that scene of quiet, safe, even though they are locked unit, you want to control the safety of that patient. That is the inpatient setting. There is an intermediate level of a care used for a modern symptoms needing a structural setting. It's partial hospitalization program. They have a day treatment, no evening stay. So they are outpatient. The patient will come and they will stay the whole day. For example, if the family are having a hard time taking care of their loved ones, it's like a daycare, but it's not daycare, it's a treatment care. So they drop the patient, the patient will stay there, they will get activity, they will get treatment, they will get whatever they need. It's between the hospital and the home. So it's an intermediate center, but it's outpatient. Patient has to have a moderate symptoms, not severe. Some of those intermediate level of care include residential care, where the patient lives and they get programs. Some of these are chronic or complex conditions. They have chronic or complex conditions, include drug with substance withdrawal, eating disorders. Those are some of the diagnoses they have. And there is a least restrictive or community setting. And this setting is a referral where it's safe. It's an outpatient therapy. It's a community mental health setting. It could be telehealth, rapidly growing. It's a primary integrated patient center, medical homes. This least restricted focus on independently, long-term recovery, social function. You wanted the patient to be integrated with the community. They will have the treatment, but they also will have activity where they conduct with others, where they go. Some of them work, even though they have a mental illness, they work and they part-time and they come. Their symptoms is controlled. They have a family. They have life outside the treatment centers or the hospitals, and it's the least restricted center, therapy center. There is other treatment. Least restricted environment is a critical and it's important. It is defined as a providing care with a fewest limitation on the patient freedom. It include respecting the patient rights. You will respect the patient rights no matter the setting. But it includes that, encourages independently, it allows the treatment refusal when appropriate. When the patient is 24 to 72 hours held, or sometimes they are held weeks, months. They have to take their medication. There's a Charvest medication that the court decides, and they have to take it. But when they are least restricted environments, they don't have that Charvest. Those are not the patient who has to have a Charvest. Their symptoms are minimum. The psychiatric psychosis is less severe. Their substance abuse is less, or they are already went through hospital and treatment centers, and they are recovery, and they are doing the follow-up appointments so they don't relapse or connect with people who are associated with this drug use or alcohol, so they have a least restricted environment. They can make their own decision. You are here to support them, to guide them, to educate them, to follow up with them. And clinical priority is only or the highest restricted environment is the safe. Risky is the safety. Clinical priority is the safety. Risky increase. You want to monitor that. Patient loses ability to function safely. So if you want to assist that, even though they are least restricted environment, that's what you want to assess as a provider. Manual therapy is a very highly, and it is restricted therapeutic environment where a daily routine is interaction, social experience, and they are used as a treatment tools. It's the setting where a daily routine happens. Is a structural therapeutic environment where interaction happens and social experience. So you gather groups. There's a groups of people, you conduct the therapy, they gather this setting, and they exchange experience, they exchange their opinion or their experience or their goals, and you guide the group therapy. The key component of that group therapy is a safe environment, structural environment, is a scheduled therapy session, is a routine, is a therapeutic communication. They want to communicate others with their goals and hobbies and recovery. Is a social learning. They want to learn from each other. You wanted them to learn from each other. So provider role is to maintain the structural of the unit. You want to promote appropriate behavior. You want to manage the environmental stimuli and safety. You want to control their participation. You will give them time to participate. You don't want to just one person is talking. You just want to give that person time, and this person time. Every person has their door or if their role that they can share time to share their goals, experience, what they like, how they see the therapy, or what they want to change, or what they like or what they don't like. Thinking the environment itself is a therapeutic. You wanted the environment to be therapeutic. So group therapy, why it matters? Why group therapy is matter? It reduces isolation, it builds social skills, it provides peer support. So they will be supporting each other, they will build the social skills, learning from each other, it will reduce isolation, they will have somebody who went through similar trauma or similar treatment that they can share with their experience and their goals. You will be the one who conducted a group therapy, one who makes sure it's safe, one who there for them to support them. There is a type of group therapy. Psychiatric educational therapy is teaching therapy. You want to teach them the medication, you want to teach them the skills that they need, you want to teach them education. There is a cognitive behavior therapy group. There is a support group. There is a skill developmental group. So there is a different therapeutic groups. Group stage. There is a group stages. There is a 3 different stages that the group go through. Orientation stage. It's when they are orientating to the group. There is a working phase and there is a termination phase. You want to introduce each other. You wanted orientation to be introducing each other, introducing the therapy, introducing the goal of the therapy. What is the goal of therapy? What to expect? And then there is a working phase that you are working on that goal that you set up earlier. We want to reach that. This is how we're going to reach that. So the step is to reach that goal. And then there is a termination. Termination phase is when you want to terminate the therapy and you reach the goal. You and the group reach the goal. You help them to reach that termination phase. You want to set up the follow-up appointment, and that is that. So the provider role of the group stages are facilitate the discussion, maintain the boundary. You want to maintain the boundary. You want to ensure the safety of everyone and confidentiality. You wanted this to be, if they share something personal, you wanted this to be confidential. Community support system. There is a community support system, and the purpose of a community support system is to keep the patient stable in the community. Example of that, keeping the patient in the community, will include case management. You wanted them to have case management that helped them. There is a set of community treatment. Housing assistant, you want to assist them with the housing. They have to house a safe house, stable, safe house. You wanted the patient to have employment support. You want peer support. You want to look for peer support. And then a set of community therapy is the highly intensity team-based care for severe mental illness patients. family support, you want to encourage the family and involve the family, the care of the patient. And the mental illness affects the entire family. It's not affecting only the person, but it affected the other family members. It will affect the husband if this is the wife. It will affect the husband, the children, the parents. So you wanted interventionists for the family. You want to conduct the therapeutic education for the family, therapeutic education. You want to support groups. You want to connect them with supporting groups. You want to involve with the family in the care planning, and that is important. You want to improve the medication adhesiveness by involving the family and educating the family. You want to educate the family about when the patient is supposed to take their medication, what symptoms to watch for, when do they have to seek help, what kind of resources they can find, if they overwhelm, where they can bring the patient, if they feel they are not safe or the patient is not safe, who they can connect. You want to give them that resource. What do they can do if they cannot take care of the patient, and where they can seek help to take care of the patient. So you want to encourage the medication adhesiveness for the patient, the outcomes that you are looking for. You want to educate them that. You want to prevent a relapse. That's why you want to involve with the family to be there for the patient. So your role in a therapeutic setting is highly yield. You want to, as a provider, you want to assist the safety and acuity of the patient. You want to coordinate the care. You want to advocate for the patient's rights. You want to educate the family. You want to conduct the psychiatric education for the family and the patient. Crisis intervention, resource navigation, that's what you want to provide and educate them. You must know the community resources, common example. Yes, you want to know the community resources that you can provide for the family and the patient. Legal and ethical consideration. You wanted the key principles is the confidentiality, HIPAA law, information consent. The family and the patient has to consent that you can share or you can involve the family with their care. You want to encourage and respect the patient independently, autonomy, safety, freedom of balancing between the freedom and the safety. You want to balance that. You wanted them to be free and do their society work there as a social productive person, but also you want to see the safety. Are they risky to themselves, to others? What is the consequences? Are they risky for relapse? So it depends. You want to assist those trends. In psychiatric care, telehealth is increasing or improving. Integration of a mental health and psychiatric health. emphasize on recovery model, trauma-informed care. What are the challenges? The challenges include stigma. It includes stigma. People who have a mental illness, they go through stigma. Stigma is a collection of a negative beliefs, and stereotype that society or the group held against someone based on their received mental health conditions. So the word stigma is a collection of a negative attitudes or beliefs or stereotypes that society or the group, the community that they come from or other community, they held that stigma against that person. So it's a mark. Stigma in Greek means a mark. They mark that person, or because they have a mental illness, they don't want to associate with that. They don't want to talk to them. They don't want to rent a house with them. They don't want to associate. Not every mental health patient is violent. Not every person is the same. So that there is a stigma that they have to go through. That is one of the challenges. Limitation to access a care. There is a limitation to access a care, especially mental health. There is a fragmental system and fragmental health. If the hospital and the community and the outpatient setting, all this therapeutic setting that we talked about, they may not connect to each other. They may not work together cohesively. So the family has to look for it. As a provider, your role is to connect them with all the resources that they can get from the hospital if they need to, outpatient if they need to, community resources if they need to. You want to educate them and give them the website, telephone, resources, who they can connect with. There is a cultural barriers. There is a cultural barriers to seek treatment for the person who is mental illness or have a condition. So least restrictive environment is the most important therapeutic area. That is the most goal that you want to reach. You wanted the patient to be safe and recovery and least restricted. You wanted them to get there. That is the goal. Environment that is therapeutic. You wanted them to find the environment or have the environment that is therapeutic, whether to come at home, at outpatient, or in the hospital. You want to make the environment safe and therapeutic. You wanted them to integrate with the community after discharge from hospital or after they are recovery stage. Level of a care known when the each is used. Your role as a provider is to coordinate the care, to assist the safety to advocate for the patient. Community care prefer over the hospital because community, they will be more freedom. They are more free to be with their family, to be with the society, with their community where they come from. Safe care model. Safe care model is safety is the first, independence is the second, family involvement. Safe care model encourages the safety first. It encourages the safety first, independent and least restricted environment. Family involvement, you want to involve with the family. Therapeutic environment, you want the environment to be therapeutic. You want to focus on the community care. You wanted least restricted environment. You want to encourage a recovery model. You want to educate and conduct psychiatric education for the family and the patient. Thank you for joining me today. I would love to see you in my next video. Thank you.